Outcomes of stereotactic radiation therapy (SRT) versus fractionated radiation therapy (FRT) in dogs with pituitary masses. A multi-institutional retrospective study, 2016 to 2022. Introduction. Pituitary masses (PM) in canines can result in neurological dysfunction and endocrinopathies. While some dogs with pituitary tumors may present with insidious neurological deficits, others exhibit acute signs, often associated with compression of the brain, brainstem, or optic chiasm. In functional tumors, symptoms are driven by hormone overproduction, whereas non-functional tumors manifest through mass effects alone. Diagnosing these masses is particularly challenging in dogs with non-functional tumors, as endocrine testing can be inconclusive. Historically, fractionated radiation therapy (FRT) has been the most utilized treatment for canine pituitary masses. However, the advent of stereotactic radiation therapy (SRT) offers a more succinct treatment approach, minimizing the number of sessions required while achieving high precision in targeting tumors. This trade-off between shorter treatment courses and potential differences in outcomes necessitates a rigorous comparison of SRT and FRT. In this retrospective study, we analyzed the clinical outcomes of 44 dogs with PM treated from 2016 to 2022. Comparing SRT and FRT protocols, the study aimed to evaluate survival times, neurologic improvement, and adverse events to determine whether SRT provides outcomes comparable to the historically favored FRT methodology. Study population and inclusion criteria. The study included 44 dogs with pituitary masses diagnosed through advanced imaging techniques, CT or MRI, who were treated with either SRT or FRT. The dogs were sourced from 3 institutions: North Carolina State University, Michigan State University, and Angel Memorial Animal Medical Center. Dogs were included based on imaging-confirmed pituitary masses, while those treated with other protocols or who had insufficient follow-up data were excluded. Treatment protocols. The dogs received either SRT, 30-35 GI in 5 daily fractions, or FRT, 50-54 GI in 19-20 fractions. SRT allows for fewer treatment sessions with a higher dose per fraction, leveraging advanced imaging and precise targeting to minimize damage to surrounding tissues. In contrast, FRT involves a more traditional approach with smaller doses per fraction, spread over more sessions, historically associated with better long-term outcomes. The protocol was chosen based on clinician preference and client considerations. For instance, dogs who were poor anesthesia candidates or whose owners preferred a shorter treatment course were more likely to undergo SRT. All dogs completed the prescribed treatment protocol without interruptions. Imaging and dosimetry. Pre-treatment imaging consisted of MRI or CT scans, both crucial for tumor delineation and radiation planning. MRI was considered acceptable if it has been performed within 4 weeks before FRT or 2 weeks before SRT, provided the clinical status of the patient remained stable. A bite block and other immobilization devices were used during imaging to ensure accurate tumor targeting during radiation therapy. Post-contrast CT scans were used for treatment planning, with go-registered MRI data to assist in visualizing the tumor and surrounding structures. The GTV was outlined by radiation oncologists, and a planning target volume (PDV) was created with variable margins, 0.5 mm depending on the institution, to account for patient movement and anatomical uncertainties. Dosimetric analysis focused on delivering the prescribed dose to 95% of the PDV, ensuring coverage of the entire tumor while sparing critical organs at risk, or such as the brain, optic chiasm, and surrounding neural structures. Dose constraints for OR were based on established human tissue tolerances, with modifications for the veterinary context. Gamma analysis and quality assurance (QA) were conducted for each patient's treatment plan. Follow-up and data collection. Post-treatment, follow-up evaluations were scheduled at 21, 42, 90, 180, and 365 days, with additional imaging recommended at 120-180 day intervals. Data collected included neurologic status, survival time, and whether the treatment improved or stabilized the clinical signs. Owners were contacted for additional follow-up if the dog did not return to the institution. Necropsy results were included when available to provide insight into causes of death and confirm tumor control. Adverse events were categorized into peri-procedural, within 48 hours post-RT, acute, within 3 months, and late, after 3 months. These were graded using a standardized toxicity scale. Additionally, cases were assessed for neurologic response based on clinical and imaging outcomes using established response evaluation criteria, e.g., RECIST. Results. Demographic overview. The study population consisted of 44 dogs, with the SRT group comprising 27 dogs and the FRT group 17. The median age at treatment was 10 years in the SRT group and 8 years in the FRT group, highlighting a slight age difference between the treatment cohorts. A range of breeds was represented, including mixed breeds, Boston Terriers, Boxers, and American Staffordshire Terriers, with no breed-specific differences noted in treatment response or survival. Clinical outcomes. The overall median survival time, MST, for all dogs was 608 days, 95% CI, 375 to 840 days, with no significant difference between SRT and FRT groups. Specifically, dogs treated with SRT had a median survival of 523 days, while those receiving FRT had a median survival of 753 days. Although the MST was slightly longer in the FRT group, the difference was not statistically significant, p equals 0.222. Notably, younger dogs, 9 years, had significantly longer survival times compared to older dogs, 9 years, with MSTs of 753 days and 445 days, respectively. P equals 0.0288. Age emerged as the only significant prognostic factor for survival, suggesting that younger dogs may tolerate radiation therapy better and have fewer comorbidities influencing their outcomes. Neurologic response and imaging findings. Of the 44 dogs, 19 showed clinical improvement in neurologic signs post-treatment, while 6 showed no improvement. The remainder had ambiguous records regarding neurologic response. Among dogs that underwent follow-up imaging, 9 showed partial tumor regression, while 3 maintained stable disease. Some dogs experienced neurologic decline post-treatment, with 8 dogs, 5 from the SRT group and 3 from the FRT group, succumbing to progressive neurologic signs within the first 6 months. Despite this, most dogs did not exhibit significant tumor growth or recurrence on follow-up imaging, though secondary effects like hydrocephalus and peritumoral edema were noted in some cases, likely attributable to radiotoxicity. Adverse events and toxicity. No major peri-procedural toxicities were noted, and only 2 dogs experienced acute neurotoxicity, grade 1, within 3 months post-treatment, manifesting as mild lethargy. Late neurotoxicity was not observed in this cohort, though distinguishing late radiation effects from tumor progression remained challenging in some cases. The retrospective nature of the study limited the ability to ascertain the exact cause of neurologic decline in some dogs, as necropsies were not performed in all cases. However, for dogs that were necropsied, findings of necrosis, fibrosis, and hemorrhage around the tumor site were noted, consistent with prior radiation exposure. Discussion. Comparison of SRT and FRT outcomes. The results of this study suggest that SRT and FRT provide similar survival outcomes for dogs with pituitary masses. Although previous literature supports FRT as the superior treatment in terms of long-term survival, the development of novel SRT protocols offers a viable alternative, particularly for patients requiring shorter treatment courses. Interestingly, the lack of significant survival differences between the 2 modalities may reflect the advances in imaging and treatment planning that have enhanced the precision of both SRT and FRT. Additionally, the patient selection criteria for each protocol likely influence the outcomes. For example, SRT may have been favored for older or more frail dogs, potentially skewing the survival data in that group. Prognostic factors and future directions. The finding that younger age at the time of treatment was associated with better survival is consistent with some previous studies in veterinary oncology. Younger dogs may have a more robust ability to recover from radiation-induced damage, and their comorbidities are typically fewer, contributing to improved outcomes. However, other commonly studied prognostic factors, such as tumor size and functional versus non-functional status, did not significantly impact survival in the study. This highlights the complexity of predicting outcomes in dogs with pituitary masses and underscores the need for prospective studies with standardized treatment protocols. A key limitation of this study was its retrospective design, which introduced variability in treatment approaches across institutions. Furthermore, the small sample size limited the ability to detect subtle differences between treatment groups. A prospective, randomized trial would help validate these findings and potentially elucidate other predictors of early death. Clinical implications and recommendations. For clinicians, the choice between SRT and FRT should consider the individual dog's age, overall health status, and the owner's preferences regarding treatment duration and follow-up care. While FRT remains a reliable and well-documented option, SRT offers a promising alternative, particularly for dogs who may not tolerate prolonged anesthesia or multiple hospital visits. Given the relatively high rate of neurologic decline within 6 months of treatment, clinicians should provide realistic expectations to pet owners and emphasize the importance of continued monitoring. Routine imaging post-treatment, although not always feasible, can help detect tumor progression or treatment-related toxicities early and guide further interventions. Conclusion. This multi-institutional retrospective study demonstrates that both SRT and FRT are effective treatments for canine pituitary masses, offering similar survival outcomes. Young age at treatment is a significant predictor of better survival, while other factors like tumor size and functional status did not have a clear impact. The study also highlights the need for further prospective research to optimize treatment protocols and improve prognostication for dogs with pituitary masses.